Douglas Barnhart, and I'm a professor of pediatric surgery at the University of Utah, and I practice at Primary Children's Hospital in Salt Lake City, Utah. I'm currently the chair of the steering committee of the NSQIP pediatric program. I've been fortunate to be involved in the development of the children's surgery verification program from the beginning with the initial task forces. It was recognized that an important part of the children's verification program would be to have good quality data about the quality of care that's being delivered in the centers. And so in the very beginning parts of the task force, we began looking at whether NSQIP Pediatric would be the place to get that data. As part of the children's surgery verification program, all the level 1 and level 2 centers will participate in NSQIP Pediatric. We're rapidly changing the NSQIP Pediatric program to help generate data that will be able to be used for centers to identify performance improvement issues. And part of the expectation of the verification program is that you take that data, look at it, and develop processes to make your care better in your own hospital. ACS NSQIP verification program for children's surgery and the NSQIP program are fundamentally linked in that the goal of NSQIP is to actually encourage hospitals to do quality and performance, not just to serve as a registry function of collecting data. And the goal of the verification process is to help centers understand what's involved in improving care. And so as a result, the NSQIP program, it views that it's fundamentally a part of verification. And so we're changing the sorts of cases and data that we collect about those cases to make it so that we can more accurately measure this quality in the centers. That includes two important changes. We're right now moving to having much more procedure-specific risk factors and variables and outcomes so that centers will have very specific, very focused data about the cases where there's the highest risk of morbidity or mortality. And then we're also piloting, looking at process measures where centers will be able to tell how efficiently and expeditiously they respond to emergencies. It's an exciting time for children's surgery care in general. I think for the first time we have risk-adjusted data so that centers know how they're doing compared to other centers, and we also have a process where centers can look at the resources they have and see if they have the resources that the group of experts feel are appropriate for children's surgery care. So I think it's going to be exciting because what we're going to learn is what things we should be measuring about children's care, and we'll be able to fairly rapidly change the NSQIP pediatric program to meet the needs that we see in the verification program. The children's surgery verification program is driven fundamentally by the idea that what we want is for every child to be in a hospital where they get the best care they can possibly receive. And that means that that hospital has to have all the resources that that child needs. And that